Dr. Aimee Sisson, Health Officer for Yolo County. You've likely heard that the California Department of Public Health will end its statewide indoor masking mandate after February 15th. Yolo County will also end its local indoor masking order after February 15th, aligning with the state. Starting February 16th, fully vaccinated persons will no longer be required to wear masks in many indoor settings. Unvaccinated persons will still be required to wear masks indoors. Certain settings, like schools, childcare, and healthcare facilities, will still require everybody to wear masks indoors. Yolo County has had an indoor masking mandate since July 30th, 2021, and many of you are probably wondering, why lift the masking mandate now? I want to walk you through the reasoning. The COVID-19 pandemic has changed tremendously from its start in March of 2020. The virus itself has changed, becoming more infectious, but causing less severe disease. In March 2020, we had no treatments for COVID-19. Today, we have effective antiviral medications and monoclonal antibody treatments. We also have safe, effective, and free vaccines available to everybody 5 and older. These vaccines prevent infections, hospitalizations, and deaths. Our initial goal with the COVID-19 related health officer orders, including stay-at-home orders, was to flatten the curve. This meant slowing the virus down, spreading cases out over time to avoid surges that would overwhelm our healthcare system. In the early days of COVID, the only way to flatten the curve was to prevent as many cases as possible. Now, the Omicron variant causes less severe disease, and effective vaccines and treatments keep hospitalizations manageable even with high community transmission. In fact, during the Omicron surge, case rates in Yolo County rose to 3.5 times higher than ever before, but our hospitals had fewer COVID patients than during the previous winter's surge. The Omicron surge is now receding. Case rates peaked at 242 cases per 100,000 residents per day in early January and have fallen to 86. If the current rate of decrease continues, Yolo County's case rate will no longer represent high transmission when the masking order ends. The decrease in case rate is excellent news, but we don't expect COVID to disappear. COVID will always be with us. Moving away from requiring everybody to wear masks indoors acknowledges that we must learn to live with COVID. Living with COVID involves fewer government mandates and more government recommendations. Public health will continue to provide recommendations to support members of the public in making individual decisions based on their own risk tolerance. Persons with a lower risk tolerance, perhaps because of underlying medical conditions or age, can choose to take additional precautions. Yolo County residents have demonstrated themselves to be conscientious of COVID-19 risks and willing to follow public health requirements. Now that previous requirements have become recommendations, I expect residents will continue to follow these recommendations to protect themselves and others. Ending mandatory masking is by no means a concession that masks do not work. Masks work. Wearing a mask that fits and filters well protects the person wearing the mask as well as others. Rather, ending the mask mandate is an acknowledgement that mandates are not the only way to support safer behavior, particularly over the long term. As Yolo County Health Officer, I strongly recommend that everybody wear masks indoors in public spaces until the case rate falls into the moderate transmission range of less than 7 cases per 100,000 residents per day, consistent with CDC guidance. Ending the local masking order on February 16th is based on the current COVID situation with the Omicron variant. Should the COVID-19 situation in Yolo County worsen in the future, perhaps due to a variant that causes severe disease or that evades immunity from vaccines and prior infection, universal indoor masking might be needed again. Thanks for watching, and thank you in advance for following local masking recommendations.